All right. Hi, everyone. My name is Dr. Robin Murphy, and I'm a naturopathic doctor at Conceive Health. And today I'm going to talk about infections, and particularly urogenital infections. Sorry, I'm just doing some technical adjustments here. As I was mentioning, today I'm going to talk about urogenital infections, and I think this is a really interesting topic because at Conceive Health, we're working with patients really as a preconception type of care. So we're working with patients who are either waiting for IVF, maybe they're going through IVF or other assisted reproductive technology interventions. And we're in the game of prevention. So what we like to do is really maximize the opportunities for fertility and a successful pregnancy. But we also want to make sure that we're understanding, are there any underlying predispositions that could potentially alter the success of your fertility or your very expensive reproductive procedure. So we want to make sure that we're maximizing your chances of a successful pregnancy. So I find this topic very interesting. When we look at infections, there's a lot that we can do from just understanding your health history, and maybe there's something that we can do ahead of time in order to just help with the environment and ensure that there's going to be a healthy implantation. So I'm going to talk a little bit about a few different types of infections here. So UTI, urinary tract infection, bacterial vaginosis, and yeast infection. And I think it's important to talk about how common they are because it's maybe not something that you talk about at the dinner table with your family and maybe don't have an idea actually how common it is. And so I looked at some stats. So essentially when we look at urinary tract infection, 25 to 40% of women have experienced one UTI in their lifetime. And the risk increases as you get older. So if you're premenopausal or if you have a decrease in estrogen, this changes the vaginal flora and notably the lactobacillus bacteria. And this can increase your chances of getting UTIs. As well, if there is a history of diabetes or current concomitant dysglycemia or blood sugar issues, we see a much higher prevalence of UTIs in these women. And for women, it varies as far as recurrence. So the actual number is about 0.3 to 7.6 episodes per year. So roughly, less than one a year to up to almost 8. So that would be every month, every month and a half, which would be quite disruptive. And what's interesting with UTIs, what we often see is that there is a connection to your menstrual cycle. So the weeks before, I mentioned as the estrogen drops, so the week before your menses, the estrogen is dropping. And as the estrogen drops, it changes the mucosal lining of the vaginal canal. And this changes the bacteria prevalence or ability to kind of bind. As well as the acidity levels. So that can increase risk for recurrence of infection. So bacterial vaginosis, there are a few different types of bacteria that can be associated with this type of infection. Often the symptoms can be more of a fishy odor that women will notice, and up to 30% of women have experienced this within their lifetime. And typically it's Gardnerella that is associated with this type of infection. So if there is a history of smoking or even obesity, this can increase risk. And then the second or third type of infection I'm going to speak about is yeast infection. So this number is huge, and most women out there have probably experienced a yeast infection. Up to 75% of women have experienced a yeast infection at some point, with 50% of college-aged women having an episode. So 1/5 of those cases report reoccurrence, so happening more than once. Typically, it's a fungal infection called Candida albicans, And we also find if an individual has diabetes or blood sugar dysregulation, then there is an increase in severity or chances for recurrence. Okay, so what's interesting about these is, I think a hot topic is whether or not these infections can cause infertility. So I'm going to speak a little bit about it from a direct as well as indirect standpoint. And I think the jury's still out with some of them. What we find is there is conflicting evidence of whether or not these bacteria directly affect fertility, but it can definitely affect the environment and other factors which can influence the ability to conceive, to implant, or for the body to, the likelihood that that pregnancy is going to be successful. So with bacterial vaginosis, it doesn't seem to affect conception itself. So the sperm is still able to get up into the uterine and fallopian tubes and fertilize that egg. But what's interesting is there are studies showing that it can increase risk of miscarriage. So this has been found with women undergoing IVF. And we also know that if there is bacterial vaginosis at the time of pregnancy, this can also increase risk for preterm birth. So it's something that, ideally we would like to address and identify ahead of time. Yeast infections itself, it creates a very thick discharge, and that discharge changes the acidity and the environment of the vaginal canal. And so what's interesting about, sperm and how they travel up to the egg is that the environment really needs to be ideal for them to be able to survive and get to their final destination. So if there's a change in the acidity levels, that can alter their survivability. It can also, the actual discharge itself can make it difficult for the sperm to pass into the cervix and cervical canal. So yeast infections, I don't think directly affect infertility, but it can definitely delay conception if, the sperm are unable to get to the egg itself. And when it comes to UTI, so urinary tract infections, it's typically, within the urinary tract, they can ascend into the kidneys, but it can create a lot of inflammation within the uterus itself, and it is associated with pelvic inflammatory disease. So over time, the risk is that there can be chronic inflammation within the fallopian tubes as well as the ovaries, and then this can actually create scarring. So the scarring will impact the ovulation process. So how successful is the egg able to go from the ovary into the fallopian tube and into the uterus? So the ideal, pathway should be open, able for that egg and fertilized embryo to be able to get into the uterus and properly implant. And then finally, we also see other types of infections that can actually affect the endometrium itself. So the endometrium, if it becomes inflamed, it's called endometritis. So this can be because of a bacterial infection. So endometritis can, again, affect the fallopian tubes. Chronic endometritis affects the fallopian tubes, the ovaries, the pelvic peritoneum. So all of this, a lot of inflammation, a lot of scar tissue, this can affect implantation of the embryo into the uterus wall. So it's very important that we identify this. So there are biopsies that can be done if there's a history or suspicion of endometritis. And that will be done by your reproductive endocrinologist. So it's not done by us as naturopathic doctors. So with some of these conditions, I talked about chronic endometritis, pelvic inflammatory disease. These disorders or diseases are associated with infertility. And I talked about how that can directly be impacted. So it's affecting the ability of that egg to actually implant into the uterus. There's also some types of bacteria that we find to be more prevalent in women who have infertility or have come across more difficulties with conception. So this may be unexplained infertility or recurrent pregnancy loss, maybe a delayed time to conceive, and miscarriage. So I spoke a little bit about Gardnerella, also uroplasm. So both of these bacteria, when they're found within the cervix and vaginal area, these are actually associated with women with higher infertility rates. We also see a lot of really interesting types of bacteria. You know, we can culture the vaginal canal. It's very easy to do. There's a swab, and as I mentioned, you can do biopsies within the endometrium itself. And what's interesting is that bacteria that is normally found within the lower large intestine, so these are Enterobacti, Streptococci, Staphylococci, these have been, the higher levels of these types of bacteria have been associated with a decrease or lower implantation rate, decrease number of pregnancies, as well as an increase in number of miscarriages. So I think at this point with the research, you know, there's a correlation here. We don't know if this is causing the lower implantation rate, but we're definitely starting to see a pattern. And I mentioned endometriosis. So it's, you know, endometriosis, there's a number of different theories, I would say, or understandings as to, you know, what is the disease process with endometriosis. And what's interesting is that there have been a number of types of bacteria that's been associated with the presence of endometriosis. So I mentioned Gardnerella. There's other ones for those microbiology geeks out there. Probiotics, again, Staphylococcus, Streptococcus, E. coli, Fusobacterium. A lot of these are found throughout the body, and they're normal in the sense that we all have them and they're present in some location, but it's all about the amounts and location. Is it a proper amount? Is it the proper location? So sometimes Staphylococcus, which is typically found within the skin, within the gut, you know, it's an opportunistic infection instead. So it's, you know, taking up viable nutrients, it's taking up viable space of some of the more beneficial bacteria that we know is associated with successful implantation and pregnancies. So I have a few questions here, which I'm very happy to answer. So I have one individual who said that she has 20% Gardnerella in her uterus. So this test would have been done by an endometrial biopsy. There's something called the EMMA test, which is an endometrial microbiome assay. So there's 20% Gardnerella, so that's typically associated with BV, bacterial vaginosis. So she finished 10 days of boric acid and vaginal probiotics. Will my lacto increase? So she brings up some interesting points. This is a great question. So first of all, I want to break this down a little bit. So will my lacto increase? So lacto, she's referring to lactobacillus. So lactobacillus is what's considered a, you know, the opportune or the best type of bacteria to have within not only the vaginal canal in certain quantities, as well as in the uterus. So certain levels of lactobacillus within the uterus is associated with higher implantation rates using IVF. And studies have been done, microbiome assays have been done to show that when there is a pathogenic form like Gardnerella or other species, what we would call invasive species, that are treated with antibiotics, and those decrease and the lactobacillus levels increase, then it increases the likelihood of implantation and pregnancy rate. So it's still on the cusp, I would say, as far as conventional practice, but this is kind of the trends that we're starting to see. So we're starting to see studies come out. This study that I'm referring to was actually done by iGenomics. So we always question, you know, is there bias? You know, because they want to show that there is a benefit of doing this test. but it's an interesting note nonetheless. And so, she's talking about doing treatment. So first, 10 days of boric acid and vaginal probiotics. So boric acid, it's obviously acidic, and what it's doing is it's decreasing the pH of the vaginal canal. So you're lowering it to that opportune environment so that the lactobacillus starts to grow and crowds out any of those pathogenic bacteria. So it can definitely be helpful in clearing infections, as well as certain types of probiotics are shown to help to eliminate some of the bacteria. Now, it's hard to say of whether or not that would have cleared the Gardnerella within the uterus. From experience, we do see that that can definitely help. And it ranges of how much it can reduce the presence of the Gardnerella. But we do know that vaginal probiotics as well as oral probiotics, I would say what we have studies on is that vaginal probiotics can help to improve the uterine microbiome. And we know that oral probiotics as well as vaginal probiotics help with the clearance of bacterial vaginosis within the vaginal canal. So without doing an endometrial biopsy, it's hard to know if you've cleared it completely. Now, this brings me to a good topic, which is antibiotic use. For some women, it is going to be important or indicated that you take an antibiotic. And this is where there is some discrepancy with what doctors are comfortable doing, because some doctors say that right before implantation or embryo transfer, there's risks of taking an antibiotic right before that embryo transfer. On the other side, the antibiotic is helpful to clear any of these potential pathogens or opportunistic infections which may be affecting implantation. So we have to see the risk benefit. On one hand, you don't want to lower the lactobacillus. So a lot of antibiotics, especially broad spectrum, they're going to kill the pathogens, but they're also going to kill some of those healthy, beneficial bacteria like the lactobacillus. So, a little bit of a long-winded answer. But what they show in studies, you can use probiotics with an antibiotic, and you would dose them at different times of the day. As well, boric acid can help with the efficacy of the antibiotic. So it depends on how long the infection has been present, I would say. Some studies will look at 10 days of using boric acid. Others will look at 30 days. There's also opportunity to do maintenance, so doing 1 week of boric acid monthly. And so with this strategy, this is for women who are getting recurrent symptoms every month. And this is the situation that I come across a lot within the clinic, in that, there's been an infection at some point, there's been an antibiotic, and then there's been a recurrence, and then an antibiotic, and then an antibiotic, and an antibiotic. What do you think is happening after you're giving antibiotics round and round again? Well, we know that these bacteria, they're extremely adaptable. So what they do is they create a resistance to those bacteria. So then it starts to become harder and harder to kill the bacteria. And then your body becomes resistant to the antibiotic. And then we also see the recurrent antibiotic use lowering the beneficial bacteria. So what do we do about this? This is where a holistic approach of looking at a number of things that I'm going to talk about, but we're going to talk a little bit about improving the immunity. So how do we do that? And I'll go into detail with all of these. So nutrients and diet, what specific diets, what specific nutrients can actually help the immune system, what lifestyle factors can improve the local and macro environment within the vaginal canal, what metabolic and hormonal factors will influence the immune system, the risk for infections, your digestive health. There are some things that you can do to help increase the beneficial microbiome within the vaginal canal. and then specific probiotics. So this isn't any probiotic. I mean, there's thousands of them, but it's not just, any probiotic off the shelf. It has to be strain specific. And that's really key because there's thousands of bacteria. There's tens of different types of these lactobacillus. And we're just, understanding a little bit more about these specific probiotic strains and what they actually do. So we want to be, just like taking a drug, just like taking any medicine, we want to make sure that we're specific with it. So immunity, I think is a huge topic these days, and there's some key vitamins. I'm sure most of you have heard about vitamin D. So vitamin D is extremely important. It's actually a nuclear factor, so it turns on hundreds of different genes to help with immune system, to help to control the inflammatory response as well as different hormones. So vitamin D is important. Vitamin A, again, similar to vitamin D, it's a nuclear factor. It's turning on hundreds of genes, as well as zinc. So those are the three that I really like to capitalize on and make sure that people are getting enough within their diet, that they don't have genetic risk factors for deficiencies. And then we do some nutrient testing. So I will always make sure to run a fertility nutrient panel for patients, just to make sure that there's no deficiencies that could be contributing to infertility as a whole, but also things like immune deficiency and recurrent infections. When we look at lifestyle factors, so lifestyle factors, it's really about some local things that affect the local environment. So things like wiping front to back is important, so you're not inoculating the lower intestinal bacteria into the vaginal canal. Appropriate use of antibiotics, so only when necessary. Exercising regularly, helping with circulation, maintaining a healthy weight. This will change your metabolic profile and inflammatory states. So I'll talk a little bit about that in a bit. And then staying well hydrated. So again, making sure that the circulation is optimal, that all the nutrients can be delivered to the area, to the cells, as well as your immune cells, travel through your blood, the lymphatic system. And you want to be able to eliminate and kind of carry away any sort of byproducts, cellular byproducts. You could think of them like toxins. This can affect the local cellular environment as well. Wearing loose-fitting clothing, so not wearing too tight or restrictive types of underwear. Cotton, something that's breathable. Ideally organic, and then voiding after sex. So regular urination, making sure that you're voiding, and then this is where we see when there's incomplete voidance. So the bladder doesn't have enough integrity and muscle strength to actually eliminate all of the urine. That can create a recurrence of infection as well. Managing stress. So this is interesting because, when we talk about this as a whole, stress, it does impact the immune system. And over time, what we see is a shift from a Th1 response into more of a Th2 response. So this can increase likelihood for things like autoimmune disease, but it lowers your body's efficiency at addressing and identifying acute infections. And so part of this process is cytotoxic killer cells, identifying the bacteria, mounting an immune response and clearing it appropriately. If that branch of our immune system is decreased, then what we'll find is that there's more of a tendency for recurrent infections. So you may notice just colds and flus more often, maybe more cold sores or breakouts, and then urinary tract infections, all the types of infections that we're talking about. This can be a sign that the immune system is having a hard time just regulating and kind of staying up to par. So I'm just going to double check my moderator here if there's any questions. Nope, not yet. So if anyone has any questions, please just type in the chat. When we look at metabolic and hormonal health. So I talked a little bit about diabetes. So diabetes can definitely is associated with an increased risk for candida as well as bacterial vaginosis. So the high blood sugar, that's providing food essentially for the bacteria. So we know that, certain dietary plans, eating a whole foods diet, eating a low glycemic, so low sugar, and low in processed foods. So a lot of the foods that go through high industrial processing, they will take out a lot of the healthy fiber and other nutrients which are feeding our body, but also our microbiome, which I'll get into in a moment, has a huge impact on our overall health. So the microbiome, what's interesting is, we have a microbiome over our whole entire body. So there's specific microbiomes and kind of these communities and collection of bacteria that are found throughout the digestive system, ear, nose, throat, vaginal, uterine, even in the fallopian tubes. And this microbiome has a huge impact on our immune system, nutrient absorption, our metabolism even, and changes within the microbiome can actually influence our behavior. So different variations within these bacteria have also been associated with things like depression, even postpartum depression. And this has been found out by studies where you'll give a probiotic during pregnancy or after pregnancy, which will actually improve the mood of the mother. So those probiotics are interacting with our nervous system in the gut and in the brain to impact serotonin levels and GABA levels. So this helps us to even out as far as our mood, to improve mood in general, as well as reduce things like anxiety. And what's interesting about the bacteria itself is it can actually facilitate in reproductive processes. So the bacteria within the cervix actually gets taken up as the sperm go up to the egg, and integrates with or interacts with this sperm and egg to help with fertilization. There's also an interaction that helps with implantation and then helps with fetal development. So it's truly this symbiotic relationship that we rely on the bacteria. So it's really important that we make sure we support our microbiome and the health of the bacteria through our everyday lives. I mean, that's such a general statement, but I'm going to talk a little bit about specifics of what you can do. But I think this is key. So one mechanism that I'd like to implement to increase your microbiome, help with lactobacillus development, particularly within the vaginal canal, is eating a lot of probiotic rich foods. So these types of foods are typically, sorry about that, so the probiotic rich foods are those that are typically fermented. So these are fermentable drinks like kombucha. So this kombucha is a fermented tea. It's become quite widely available even at Loblaws and different health food stores. Yogurt and kefir. So naturally they'll have lactobacillus culture. And this is what creates the sort of acidic or sour taste of yogurt. Kimchi, as well as sauerkraut, pickles, miso soup, tempeh. There's quite a few different options. And if you're just getting, familiar, just starting out with fermentable foods, I do not recommend eating a giant bowl of this because you will definitely have a lot of gas and bloating. So these probiotics, there's trillions and trillions of these healthy bacteria within these foods. So it takes time for our bodies to adjust. So you don't want to kind of overload it and bombard the digestive system. A little bit a day goes a long way is typically what I say. So I did not mean to make that entire thing rhyme, but now you'll remember it. So probiotic foods is a great way. Prebiotic foods is another easier way. So if your palate, you're not used to the fermentable foods, prebiotics is another great way. So this is resistant starch. These are foods that are high in fiber. And what that means is that your body doesn't digest them. So your digestive enzymes will not break down these types of fibers if they're resistant starch. And so those little fibers will then go into the lower intestine, small intestine, lower intestine, and they're feeding the healthy bacteria. So the more you feed these healthy bacteria, the more that they're going to crowd out any of those other pathogens and help with a healthy microbiome. And so prebiotic rich foods are things like green tea. So green tea has actually been shown to reduce recurrence of UTIs, of yeast infections. Other foods that are really high in prebiotics, leeks and onions, artichokes, garlic, and oats, and even bananas. And bananas it's interesting because it's the green bananas that tend to have the highest level of these resistant starches. So it tends to give you the biggest bang for your buck, essentially. And, the average American diet, there's about 6 grams of fiber that are consumed a day. Our ancestors used to eat 146 grams. So if you're experiencing any constipation, anything like diverticulitis or losis, which is the outpouching of your colon, just slow transit time. So slow transit time, hard to pass stool, dry stool, all of this can be a sign that you're not getting enough fiber in your diet. So bulking up the stool with fiber can be a great way just to help with regular bowel movements as well as improve your microbiome. And then the last piece that I want to talk about today is different probiotics. So there's a great website that I like to reference, and what they do is they kind of update different specific strains of probiotics according to the research and what their indications are. So this is called, I lost it. It's Probiotic Chart, probioticchart.ca. And what you'll find here is a list, and you can filter the list according to the indication. So when we look at fertility specific probiotics, we want to look at different strains of probiotics which have been shown to help increase the levels of lactobacillus within the vaginal canal, or to help reduce recurrent infections. So when it comes to infections, there's 2 specific strains which have the most research. There's lots of different strains that you can use. So the first one is Lactobacillus rhamnosus, and then the other one is Lactobacillus fermentum. So they have specific identifiers related to the strain and the species. So Lactobacillus rhamnosus, GR1, and then Lactobacillus fermentum, RC14. So both of these have been shown to be successful in reducing recurrent UTI, urinary tract infection, bacterial vaginosis, and group B strep. And what's interesting about these two is that they've also shown to help reduce biofilms. So biofilms is one of the reasons that bacteria can become resistant to treatment. These biofilms are like little domes and ecosystems that protect the bacteria from the immune system, as well as from the antibiotic or even natural herbs from getting into the environment to actually kill the bacteria. So if the antibiotic is unable to actually come in contact with the bacteria, then it usually doesn't work very well. So these biofilms is one of the reasons that you'll see recurrent infections. So I mentioned how boric acid can help with biofilms, as well as some of these bacteria. So we'll use oral as well as intravaginal. So it's actual vaginal suppositories, And then there's other types of lactobacillus. So this is an interesting study. It showed that Lactobacillus crispatus was associated with higher rates of success with IUI, so intrauterine insemination. So it shows, it's probably interacting with that fertilization and helping with implantation. It may be a correlation, but it's an interesting piece of information to keep in mind. There's other types of bacteria, so Lactobacillus rhamnosus, there's a few different strains, HN001 and BPL005. I know this is really technical, maybe it sounds like gibberish, but it's important that you know these strains. So these two, Lactobacillus rhamnosus, have been shown to improve postpartum depression and anxiety, as well as interact directly with the endometrial lining. So I think that's really, amazing stuff, that we understand how these bacteria interact with our system, as well as that we can actually provide this as a treatment to help potentially clear some of these recurrent infections. So just to recap, if you're experiencing recurrent infections, whether it's UTI, BV, yeast infections, it's important to look at the whole system. So understand what are the contributing factors which could be leading to a recurrence of these infections. Are there biofilms and an inability for the antibiotic to actually penetrate and address this? Is there a lower immunity? Is there other diseases or pathophysiologies like blood sugar dysregulation or chronic inflammation, which could be impacting the likelihood of these recurrent infections? Is it structural? So we have to think, are there obstructions, scar tissue, or other things like abscesses or cysts in the area, which could be contributing? And then what are the lifestyle, strategies, lifestyle habits? What is the diet? Is there a lot of nutrient dense foods, or is there a lot of processed foods high in sugar, high in fats, which can compromise the body's ability to really address these infections, as well as kind of feed some of the infections and the longevity of it. Looking at all of this, it's important to work with a healthcare practitioner. So all of the doctors at Conceive Health, we all provide kind of 15-minute introductory calls so you can understand a little bit about, how we work and how we can help you. So make sure to go to the link above and look at the team. There's 7 clinics that we're working at across Ontario. So check us out. There's also some really cool tests. I mentioned how there's the EMA test, the endometrial microbiome testing, and I was just speaking with a company the other day based out of California, and they do vaginal microbiome testing. So this is a much more cost-effective way to start. I would use it as a screening tool, so I'm going to be bringing it into clinic hopefully within the next month, and this is something that we can use if you've had a recurrence of infections. We can use this as a screening tool to identify, are there any presence of bacteria which could be impacting your likelihood for implantation or a successful pregnancy, especially if you're coming up to doing an IVF or any sort of reproductive support. Make sure to do that ahead of time. I have a question here, and that talks about, so how does endometritis affect implantation? So endometritis is actually an inflammation of the uterine lining. So the uterine lining, it's very interesting when you look at the biological markers that occur when a baby implants into the endometrial lining. There is this complex interaction between the immune system and signaling to make sure that that embryo is able to implant properly. And if that signaling isn't able to be constructed or orchestrated in the right way, then we can see that there's a reduction in implantation. So we do see that with endometriitis. And I mentioned that there are studies showing chronic endometritis if it is identified, so that'll be through an endometrial biopsy. So if an antibiotic is used, then it will increase implantation rates and successful pregnancies. So there is studies showing that as well. And then as far as the screening test that I mentioned from California, so I didn't mention the company. I think it's fine for me to mention. I think you guys should check them out. So it's called Juno. And I'm just going to look up the website here. So it's Juno Bio, I believe. Yeah, juno.bio. And they look at vaginal microbiome. So what's interesting is you can look at, so say a woman comes in with bacterial vaginosis. A lot of the tests will only look at Gardnerella. So Gardnerella, because it's commonly associated with bacterial vaginosis, you go to your clinic, you have very clear signs, the test comes back negative. What do you do then? So what's interesting about this is that there are other bacteria that are associated with bacterial vaginosis. They're just not as common. And so not every test out there is going to test for this. So especially if you've had a negative but you're still having symptoms, then I would say make sure to follow up and get some more testing. So this company in particular, they do over 300 different analytes. And as I mentioned, they're still considered a screening company, so they are kind of more a research company, but it does help us to understand a little bit more about the vaginal microbiome and how they may actually, impact your uterine microbiome. So very interesting stuff. So as you can tell, I'm really excited about, some upcoming developments. If any of you guys are kind of dealing with some of these symptoms or you want more information, please go to our website and make sure to give us a call. So thanks everybody for joining me today. It was great having everyone on here, and thank you for your questions. And I hope to see you back here soon. Okay, take care everyone. Bye.